Welcome. We're so glad that you've taken the time to join us today for this morning's webinar entitled Sugar-Sweetened Beverage Reduction Game Plan, Turning Data into Action. Our goal here today is to reinvigorate the conversation around sugar-sweetened beverage consumption and to provide each of you with fresh ideas and inspiration in your organization's efforts to give children in our communities the healthiest start possible. So to begin, we want to paint a picture with data. So the Los Angeles County Department of Public Health recently released a report on sugar-sweetened beverage consumption among children and youth in LA County. So we'll go through the data presented in that report and talk about why this matters as an issue. And next, we'll get really practical. We want to talk about how do we use those data to identify changes that can reduce sugar-sweetened beverage consumption. And third, we'll cover the recommendations that the Department of Public Health has identified as potential ways to move the needle on this important issue. And our second speaker will then show us what this looks like in practice at a school-based setting. So we've got some great speakers for you today. With that, I'd like to go ahead and get started and introduce our first speaker, Deepa Shah Patel. Ms. Shah Patel is the director of our Nutrition and Physical Activity Program in the Division of Chronic Disease and Injury Prevention at the Los Angeles County Department of Public Health. She's a seasoned public health administrator with over 20 years of experience implementing nutrition programs to improve the health of low-income, vulnerable communities, especially communities of color. She's been recognized for her leadership in establishing healthy school environments, excellence in public health programs, exceptional media and communications, and health equity. So please join me in welcoming Deepa Shah Patel.
Thank you so much, Kelly, and thank you everyone that's joining today. I know we've got a great turnout, and we're so excited that many of you are here today to learn about our recently released report focused on sugar-sweetened beverage consumption among youth in Los Angeles County. Consumption for sugar-sweetened beverages remains a top priority for public health. Sugar-sweetened beverages are the leading source of added sugars in the American diet, and we know that the excess consumption of sugar-sweetened beverages contributes to a variety of diet-related diseases and conditions, including type 2 diabetes. Our Board of Supervisors is particularly interested in diabetes prevention, and on November 15th, 2022, the Board of Supervisors recently adopted a board motion, which included a directive to widely disseminate our recently developed report. And in addition to today's webinar, we'll be working with partners across LA County to promote not only the data in this report, but also implement some of the recommendations that are included. So stay tuned for more information about these events. So to get us started, we'll talk a little bit just about definitions. So sugar-sweetened beverages are defined as drinks for the purposes of this report they're sweetened with various forms of added sugar, like regular soda, fruit drinks, sports drinks, and energy drinks. And this data draws from the LA County Health Survey, which is administered through our department every 2 to 3 years. This report evaluates data from 2007 to 2018 and specifically highlights demographic and geographic trends in consumption across Los Angeles County. So just a few data points that we'd like to start off with broadly. In LA County, approximately 1 out of every 3 children ages 17 years and younger consumed at least one sugar-sweetened beverage on an average day in 2018. And in 2018, sugar-sweetened beverage consumption was higher among Black and Latino children at 47.6% and 43.1% compared to Asian and white children at 25.4% and 21% for white children. And we'll actually get into some of that data in a moment. The next slide here, we've got looking at consumption among children. So when you start to break down by the different age groups, 42.1% of children ages 6 to 17 consumed one or more sugar-sweetened beverage per day. And then consumption among children 6 to 11 was 39.3%, and then going down to the smallest ones at 0 to 5 years of age was 26.5%. taking a little bit of a deeper dive into the trend lines for looking at it by, when you disaggregate the data by race and ethnicity, you start to see overall the picture looks good. When we look at the data in the aggregate, we see that consumption is steadily decreasing. So that's where we're looking at the blue line in the middle. So in 2007, the consumption among youth was at 43.3%. And then we're looking at 2018 goes down to 37.2%, which is great news. And then we start to look at some of these disparities. When we look at consumption among Black children in 2007 to 2018, we see that in 2018, consumption of sugar-sweetened beverages remains 10.4% above the overall population consumption, and more than double when compared to white children. These similar trends are observed among Latino children as well, where sugar-sweetened beverage consumption since 2007 has decreased, but remains higher than the overall population consumption. So we see again with the trend lines, then the green, so we've got Black at the top here, Latino at the second trend line, the third is the overall. And then here we have Asian right here, and then in the green we have white. Next slide. So we see regional differences as well in sugar-sweetened beverage consumption, and this is by service planning area. So we see the highest consumption in the South, again, coming down. So we're looking at the South spot, 55.4% in 2007 compared to 51.6% in 2018. And this is, you see a stark disparity here with consumption when you look at the West spot. So communities like Malibu, Santa Monica, Beverly Hills. This was at 25.1% compared to 16.7%. And really looking at these regional differences, you can look at it a bar graph, but then when you look at it a map, you can really see that there's these large regional differences in sugar-sweetened beverage consumption across the county. Again, just looking at the communities that are represented in West, as I mentioned before, Santa Monica, Beverly Hills, Malibu, and then compared to South Spa, where consumption was the highest at 51.6%. And these include communities like Crenshaw, Linwood, and Compton. What's really great about this data in this report is that we have data by the sub-spa level, so kind of not necessarily at the city and community level, but this is by health districts. So again, the findings show these large regional differences in sugar-sweetened beverage consumption, with lowest consumption in the West spot, 16.7%, Glendale, 16.9%, and Alhambra at 17.1%. Districts with the highest consumption were in the South, including Watts and Florence at 57.2%, Compton 53.6%, and Southeast, historic South Central, South Park, Florence at 50.4%. And you can see when you take a look at the report, there's a page that includes all of the health districts as well. Moving down to the percentage of children ages 0 to 5 in households with incomes less than 185% of federal poverty level who drink more than one sugar-sweetened beverage per day by WIC participation status. So looking at the overall children, the consumption there is at 33.6%. We'll see that at the children who participated in WIC is lower at 32.1% and much lower compared to children who never participated in WIC at 40.7%. So of course, these disparities are very concerning to public health, and I'm sure to all of you, because we know that excess consumption of added sugars contributes to many health conditions, including childhood and adolescent obesity, dental decay, heart disease, hypertension, type 2 diabetes, and all-cause mortality. So of course, when we're looking at these diseases, we we say these things, but when children and adults actually experience and have to manage these health conditions, it's very difficult, and it has a huge impact on overall health and on mental health as well. So what we're seeing in this data, we see that this is really when we're looking at sugar sweetened beverage consumption, we see the huge differences in consumption among race, ethnicity, and geography across LA County. We see that this is really, these inequities are outside of any individual or family's control. This is really beyond choice. This has to do with systemic factors and structural racism that lead to the inequities that we see today. We see targeted marketing to Black and Latino children on not only beverages, but food as well, specifically foods that are lower in nutrient density. We see that there's a limited availability and proximity of nutritious foods and beverage options in certain communities. And then we, of course, see disparities in access to safe and appealing tap water. And all of these contribute to the inequities that we see in the data. So looking at this data, and we really appreciate that you taking the time out again to participate in this webinar. We know that oftentimes there's reports that are released, but we don't often have time to really dig in and read them. So we wanted to, be able to create this space and platform for all of us to go through this data. So how do we go from data to action? And we know that data is only one tool in the movement towards reducing sugar-sweetened beverage consumption. Data can be used as an important foundation to operationalize systemic changes, tell stories, plan and administer programs, create social marketing campaigns, and engage communities in grassroots organizing. But practically speaking, how are we moving from data to action? And there's lots of different approaches, and it may not always be a linear process, but some of the common steps include using the data to paint a picture of the health disparities. You can identify where they are, what they are, who is affected, and why these disparities exist. A next step is to take the data and marry it with what's in the literature. So what's in this evidence-based and scientific literature? What does the evidence say about why these variations may exist? And once you've identified what the issues are, where the barriers lie, what are some evidence-informed changes that can serve as effective levers for these barriers or issues? And so many health disparities are intersectional and related, and that event interventions that address social determinants of health may be important starting point in addressing sugary drink consumption. What's also critical in what we're doing today is looking at what other organizations are doing. So for example, how are other school districts making changes to get students to drink more water instead of sugary beverages? What are healthcare settings doing in terms of making procurement changes to offer healthier beverage options to employees? And no matter what your setting is, partnering with other organizations and learning from their efforts is a great place to start. Lastly, it's important to balance feasibility and realism with aspiration and impact. So determining the feasibility and impact of an intervention can be a difficult balance, especially given the constraints of time, resources, complex legal issues, and the vast amounts of money that are spent on advertising and marketing sugar-sweetened beverages. But that doesn't mean that we're powerless. Even feasible and realistic programs or awareness campaigns can have a big impact. So don't forget that a healthy dose of aspiration when planning your next steps in addressing sugar-sweetened beverage consumption in your respective organizations. And with that in mind, we can go through some of the recommendations that the Department of Public Health has included in the sugar-sweetened beverage report in response to the data. So first, we have our first recommendation is that national school meals programs should aim to ensure access to healthy beverages and discourage consumption of sugary drinks. So oftentimes there's policy changes that are made at the national level, and that we should definitely take into account the local impact. And a small example is that during after the passage of the Healthy Hunger-Free Kids Act in 2010, it required flavored milks to be fat-free as part of this national school lunch program. The previous administration had changed that to allow for low-fat flavored milk, which often has more added sugar and calories than fat-free flavored milk. So small policy changes can have a local impact in terms of consumption. The next recommendation is that federally funded nutrition assistance programs should expand evidence-based nutrition education on negative health impacts of SSB consumption. So programs like WIC, like SNAP-Ed, locally known as CalFresh Healthy Living, these programs are really important. And we saw in the previous slide that WIC really has a protective factor when looking at sugar-sweetened beverage consumption among youth. And so, that has to do with nutrition education and what's offered in the WIC package. But these federally funded nutrition assistance programs can expand what they're currently doing and build upon the successes. Looking at taxation, taxing sugar-sweetened beverages has emerged as an important policy strategy for addressing overconsumption of sugar-sweetened beverages. A handful of cities across the United States, I believe it's about 7, have enacted sugar-sweetened beverage taxes. These research shows that these taxes are associated with higher prices and then consequently lower sales of taxed beverages. The funds that can be generated can be like 1% of the general fund, and creating community advisory boards to ensure that the revenue generated does go towards communities that have been most impacted by marketing and most impacted by historical redlining, all of these things to put money back into those communities to increase access to water and make it more appealing, and creating other programs to promote good health. The next set of strategies have to do with implementing behavioral economic strategies. So these are essentially our marketing strategies that focus on price, placement, looking at schools that implement these programs, for example, the Smarter Lunchroom movement of putting flavored sugary milk in backs, so kids have to reach a little farther. In organizations looking at vending machines, putting water at eye level for people, making the price a little bit lower than sugar-sweetened beverages, are all techniques that can help reduce sugar-sweetened beverage consumption. Looking at marketing in public places. So research has shown that marketing towards children and adolescents can influence food preferences among children, including the consumption of sugar-sweetened beverages. Schools have made tremendous progress over the last 20 years with statewide policies, SB 19, SB 965. Building on that, looking at, for example, advertisement of tobacco products and alcoholic beverages are prohibited currently in LA County within 1,000 feet of premises where children are. So schools, parks, playgrounds, recreational facilities, youth centers, child care centers, churches, etc., anywhere where children are. These kinds of limitations can be extended towards and applied to sugar-sweetened beverages in terms of marketing, so that we're reducing the exposure of marketing of unhealthy food and beverages to children. And then lastly, making drinking water safe, accessible, and free throughout communities and schools. We've got great examples of this with the speaker, with John Cousins, following the presentation of this data, that talk about what really can be done in schools to make water more appealing and more accessible by installing hydration stations. Our CalFresh Healthy Living program is working with partners across the county to do that, and we're really excited to share that example with you. And with that, that concludes the data and the recommendations from the report. If you have any questions, I think Kelly will be coordinating those. Thank you.
Thanks, Deepa. Please feel free, as Deepa mentioned, to, if you have any questions, to use the Q&A feature in Zoom. I think it should be on your bottom or bottom right of your screen. So please feel free to use the Q&A if you have any questions that you'd like Deepa to cover. And we had a couple that were submitted ahead of time with the registration. So I'll start with those as folks are dropping their questions in the Q&A. So Deepa, first, one question we got was, how effective are education initiatives for reducing consumption of sugar-sweetened beverages when compared to legislation and taxation strategies?
That's a great question. So when it comes to comparing these types of interventions, it's not necessarily an either or, it's an and. So we know that important to have a comprehensive approach. We need to have the communities and the public needs to be informed, aware, and educated, not only about the negative health impacts of sugar-sweetened beverages, but also what the industry is doing in terms of targeting marketing techniques towards Black and Brown communities. Looking at comparing also that this is what was done in very similar ways what big tobacco has done in the past. There's actually a study that just came out in 2023, so just a few weeks ago, on looking at the effects of a tobacco tax, a sugar-sweetened beverage tax that was passed in San Francisco, looking at it for over 2 years after the tax was passed. There was a 36.1% reduction in consumption of sugary drinks compared to a city that did not enact a sugar-sweetened beverage tax, and that was San Jose. San Jose went down 16%. So we're looking at overall, the trend line is going down of sugar-sweetened beverage consumption. But so looking at putting in various strategies in place to help reduce it further, and then specifically for specific communities where we do still see it as higher than other communities. So all of these strategies are important, and it's difficult to quantify which one is more effective. We know that all of them are really important in reducing sugar-sweetened beverage consumption.
Thank you. And yeah, I love that that we actually do have some data to sort of shore up some of these interventions, and that really gets at what you were talking about earlier in your presentation, was sort of marrying the data with effective interventions. So thank you for that. The next question that we got is sort of a three-parter. So first, how do you plan to market these beverages to make sure the reduced sugar beverages are more attractive to consumers than other more sugary competitors? And second, do you foresee any pushback from consumers as a part of these efforts? And then if yes, if you do see pushback, how do you plan to combat it, and what messaging can be used to move the conversation forward? So I guess the question is sort of, how do you market these, and then how do you deal with any pushback from folks who may not be as interested in the reduced sugar beverages?
Yeah, so I just like to start off with the data again. We do see an overall decreasing trend line, and that has to do with the fact that people are becoming more educated and aware and informed about the negative health impacts of sugary beverage consumption, but also the industry is responding with various choices as well of low sugar options. There's a lot out there in terms of choices and what the industry has to provide. So that's a very good thing. But if we want to see an excellent example of what great marketing of healthy alternatives to sugary drinks looks like, we can see Coach Cousins and the Glendale Unified School District's CalFresh Healthy Living team. They have done an amazing job with making recipe demonstration videos that make every single drink look so good. Nothing will make you want to grab your blender and make a strawberry smoothie faster. So you can look at Glendale Unified School District's their website there, which I think John will share with you. There's also the state's Rethink Your Drink resources and websites that they have. They have recipe cards, other tools to market healthier options and prioritize them over sugary beverages.
Great, thanks, Deepa. And as Deepa mentioned, we'll be sure to share some resources with you all in our follow-up email after the webinar, particularly gusdhealthyliving.org, which is Coach Cousins' awesome website. Another question that we're getting is really getting at the action step. So how can folks get involved and take action on this issue?
Yes, there are a lot of different ways to get involved and take action. You can be a champion at your respective organization, raising this issue, say, hey, look at this data. We see a lot of disparities. This is something that's very important in terms of nutrition and chronic disease prevention. There's also, if you look more interested on the policy and advocacy side, there's coalitions. One in particular I can think of is Californians for Less Soda. This is an organization that's comprised of the American Heart Association, other local nonprofits and statewide nonprofits that are focused on a variety of different things. One specific thing right now they're focused on is repealing preemption. So right now, any local jurisdiction cannot pursue a sugar-sweetened beverage tax based on what happened with the California. That's what the California state legislature voted on. So right now they're looking to overturn that or address that and test that to see if any local jurisdictions can go ahead and use every tool in their toolbox to be able to raise to generate revenue for their communities that they serve. So that might be a coalition that folks are interested in joining.
Great. So a couple of other questions that we got that we probably won't address today, but I just wanted to acknowledge that folks had sent them through. The first is, how can you effectively let clients know to reduce their sugar consumption? And then related, how can we reduce the craving of sugar using natural fruit infused water? This is a common question as some patients find it difficult to go from drinking high sugar content beverages to suddenly cutting it off. So appreciate those questions about reducing consumption. I don't think that's something we'll necessarily cover today, but please do check out the resources that we'll distribute with the webinar recording, because there may be some that are of interest in more of a healthcare setting, which those sound like they might be. So just wanted to acknowledge that. And then I also wanted to plug, we got a question about, do you have a training in Spanish or Spanish translation? And while today's webinar is obviously not in Spanish, I do want to plug that the Los Angeles County Department of Public Health and our Nutrition and Physical Activity program does have a promotores listserv for community health educators that has both Spanish and English resources. So we'll be sending out a link to sign up for that as well in our post-event resources, but just wanted to cover a couple of those that we aren't necessarily going to be talking specifically about today. So with that, I want to thank Deepa for taking our questions. Thanks so much, Deepa, and we'll go ahead and move to our next presenter, and thank you to everyone who submitted questions both before the event and during. So please note that you can feel free to continue asking questions through the Q&A feature. We will have some time after the next presentation to go over questions as well. So don't hesitate to submit those. So I want to go ahead and take a moment to introduce my colleague, Rita Mosian, who is going to introduce our next speaker. Thank you.
Great, thank you, Kelly. So now we're actually going to hear one of the recommendations in the SSB report in action. So you're going to hear from one of our CalFresh Healthy Living School District partners, Glendale Unified School District. And one of the sub-strategies our school district worked on was improving the school environment by implementing youth engagement projects to increase water access and consumption in their middle school sites. So the school district used the YPAR framework, and you're most probably familiar. It stands for Youth Participatory Action Research, which is a community-based social justice research framework that supports the leadership and the knowledge of youth that are most affected by disparities to come up with the solutions. So the objective of the strategy was to install a minimum of one freshwater access point and promote water consumption along with nutrition education and healthy beverage activities. So now I'm going to give you a brief overview or introduction to John Cousins, our health educator from Glendale Unified School District. So John is a man of high enthusiasm for youth development and a vision for developing on expectations. John Cousins maintains that helping youth succeed by putting them in the driver's seat. Cousins believes in cultivating a diverse plan of actions that involves collaboration from all invested parties toward building an essential program that is sustainable, fosters healthy life choices, and leadership development. So John, I will pass it on to you.
Good morning. Thank you, Rita. Thank you, Kelly, and amazing presentation, Deepa. Hopefully today, when you all leave, you will find some of this information that we've shared to be helpful for you and your organization. So today, of course, we're going to talk about the behavioral economics involving water access and appeal. So we're going to discuss the planning process, the implementation process, and share with you some of the data pieces behind the work that my teammate and I have been able to put together. So what I'm sharing out today, some of my opinions, as well as some of my teammates' opinions. Gina Lackagnina, the program coordinator with Glendale Unified School District. So here we are today. Slide. Well, obviously the first process is the planning process. It's one of the more important processes, if you ask me. You want to take your time to make sure you get and gather all your resources that you're going to use for this particular project. We're at a middle school and we're working out of a middle school. And I know you may be thinking, why PAR at a middle school? Interesting, right? I know we hear a lot about why PAR during the high school times and things of that nature. And it sounds on that level, it'll be pretty simpler. But here in the middle school, we basically took advantage of all the trainings that EPA provided us. We made sure we recruited particular champ teachers. Each year we recruited in a different method. Our first year we recruited so that we got a teacher who was aligned with health. So she was our consumer science teacher. And this year we have another health aligned teacher who is our physical education teacher. She's actually the lead of the 3 teachers at our middle school site. We also rebranded the water access and appeal, because when we talk about that and we use the word YPAR, we'll lose a lot of people, even adults. They're looking around like, what is this? What is that? So we just rebranded it and we decided to kind of think like the young people. So, we named the team DRIP, right? DRIP as in water, but obviously for youth, it's something completely different, right? But that's something, again, that they can gravitate to. So I definitely suggest you finding a way to popularize the name and kind of become cool to the kids so that, you can get their interest to even have this discussion. We recruited a youth team, 2 different sizes over the years. Last year in year 2, we had about 6 students, which we've learned quickly that we should have got more. And we did. Year 3, we're looking at about 45 young people. Okay. Now, when it comes to the implementation process, we saw them more than we, the scope of work asked us to. I mean, and a lot of times that's what's needed. You're going to have to spend more time with them to make sure you're getting accomplishing all the different scope of works that you're trying to tackle, and to make sure that you're teaching these young people the things that they need to know. We facilitated team building activities, different research methods, different styles of leadership so that they can understand what they were about to get into. We had pre-survey efforts and assessments of water consumption and what the students thought about the existing situation for water, from their water stations to appearance, to taste, and all those things. We coordinated some trainings with our wonderful FIN partners to help these young people develop promotional campaigns and improve their public speaking skills to prepare for that final presentation, which is going to be important for a lot of different schools. Unlike our situation, which we'll tap into a little bit further, but that's important for you to make sure that kids can present and know how to speak their mind and share information to particular stakeholders. We followed up with a post survey as well, and we helped the young people synthesize and analyze this data and its findings to come up with a presentation. So with our pre-survey, we had about 43 students in between the class that we were working with, 2 classes actually, consumer science and an art class, where we had a few other students between the 6. And with this particular data piece, we found out a lot about water consumption when it comes to the young folks. And we found out that the majority of the students, 45%, don't drink from the fountains at all. And there are several reasons why they didn't drink from the fountains. So if you look at our pre-survey pie here, I mean, you'll see a lot of some of the same responses here. We have yes a few times, but we really wanted to tap into how often they were saying yes. Was it often, was it rarely, or was it every day that they drank from the water stations, or was it just absolutely no? And you may not be surprised by some of the findings as to why 45% of the students didn't drink from the fountains. Some of the top barriers that were identified by the students were, of course, the fountain was dirty. We'll share a picture with you in a moment to show you how filthy it looked. But the fountains are dirty, so that means presentation is going to be a big thing. It's very important to the young folks to make sure it all looks good and it's all prepared and put together. There's low water pressure, because when you think about those old-fashioned water fountains. You're gonna stick your fist down low. And when we're dealing with this COVID and post-COVID era, that's kind of bad. Germ spreading, virus spreads, and things of that nature. Also, the water didn't taste good according to them. So I guess that's something that we had to look into when it comes to water test tasting, as well as maybe find out the source of water and figure out what those policies that are intact to that, as far as regulations and how often it's checked. And then a lot of times the fountains didn't work. And there was one water station at this particular school site, the middle school, and its water fountain, it broke down frequently. We come one day, it's working, the next day it's not. And of course, that's when the process really began for us. Other findings was just that, there were trip hazards and other tools and supplies from the school in the areas, mops and brooms and hoses and things like that, that would, again, appearance didn't get the kids to gravitate to the particular station. So that's some of the findings that we found out as to why 45% of the students did not drink from that fountain or that one particular station. Lucky for us at Glendale, we were fortunate to be housed inside of a nutrition service department. And our office is on the facilities and operations and custodial team site as well. So we're not actually at a school per se, we go to schools, but we're at a site where a lot of people are, and a lot of these folks were vested partners, right? So if you look at the main character sheet here, our nutrition services administrator, we were able to share the pre-survey results with her and highlight the barriers that the students identified to get more response from this particular person. And she acted, because again, you want to make sure you involve all vested parties in what you're doing while you're doing it, and not when they're needed, because of course, no one wants to find out about something at the end of the process. So we let the nutrition service administrator know ASAP all the situations that were going on the list of barriers that we saw. The appearance, the trip hazards, the functionality of it, and everything. In addition to that, we had the facilities administrator right on site as well, who the nutrition service administrator is frequent with. So we talked to them about, and the administrator talked to them about, talked to us about the plan that was already in place, right? Understanding the grant came in 2020 in the middle of COVID. So there was a plan already in place, thinking ahead and being proactive as far as like, hey, we're going to purchase some water filling stations already. And we're going to make sure we get them to our school. So this was something that was already at the forefront with the district. We were just on the CalFresh team, we were just able to sort of expedite the process to kind of speed up everything for the most part. And that ended up leading to 8 new water stations, lo and behold, right? Amazingly. The custodian operation, the next person, the custodian operation administrator, we shared the feedback about the water stations being turned off, being broke. So of course, they'll go check it out, fix it up. And then we spoke to the operations coordinators at the school sites that handled the custodians, and they made sure that they repaired these drinking stations. They cleared all the equipment from the area, the trip hazard, and gave the water fountains a good cleaning. So again, we were fortunate enough to have all these people in-house. And I do want to let you know right now, there are 4 main characters, but technically there are 3. The nutrition service administrator also is the administrator for custodian services. So we were able to get a lot of good push from that. So that's something to think about when you're working on this particular initiative. It's not just about the school administrators and the teachers. You got to make sure you get all those vested parties that are involved in it together from the start, right? Slide. So one of the things that we worked on with our young people with the marketing campaign is we had quite a few things going on, and we had morning announcements. You get these every day after the first bell at school, and right after administration says the things that they have to say, our young people on Team Drip came in and were able to give announcements 5 days a week, 2 days a week, with a combination of different messages. And you can see here one of the messages that we have, and I'll go ahead and read it for you. We used to only have 1 bottle filling station on campus that would break down all the time. But now we have 8 brand new stations that dispense cold and clean water that tastes delicious. And this is just an example of one of the morning announcements that 6 students came up with. 6 students had their own announcements, okay? So they thought for themselves, they came up with their own ideas, and voila, we brought it to the principal and administrator's attention, and they were okay with it because once again, we shared this movement well in advance and sort of anticipated all the folks that we will need at some point. So we always made them part of the process slide. Another component we had was we had our posters near the hydration station. So, we had some posters that they made. They competed to all make posters, and we went around to the 8 different water stations and made sure that they had some posters set up, some authentic organic posters from the students, as well as some of those lovely posters that you all could get from the storefront that the state provides with DPH and CalFresh Healthy Living. The other thing that we did, because you want to make sure you're being active and you're channeling all these different methods and ways to gain different people's attention, right? Some folks like to hear, some folks like to see, some folks like to be a part of things that are going on. And this is something that makes folks a part of what we're doing by showing them why we're trying to get them to get away from the SSBs, okay? So we had our Rethink Your Drink demonstrations where Team Drip would assist the CalFresh Healthy Living team with demonstrations of fruit infused water, trying to get our students at lunch to drink healthy beverage outside of those juices that they get, which don't have any additional sugar. They're all natural sugars, by the way. So our demonstrations were a huge success because we get a flock, if not just completely been bombarded by students wanting to drink healthy. And not only that, when you can look at this picture here, you see some strawberries floating on top of that water with the ice. We don't let the strawberries go to waste, right? That's a shared table conversation too. But we made sure once the water was completely out, we made sure that we scooped those fruit and put it in the cups and allowed those kids to get a fruit sample and walk away happy, not only with a healthy beverage option, but also getting a serving of fruit that particular day. So never waste anything that's inside. Kids actually love the basil, they love the mint, they'll eat anything, the cucumber that's inside infused in that water, I assure you that. So just taking a look here, you see our before picture. You see that trip hazard, it reminds you of the rodeo and the cowboys and the lasso. Don't get your foot caught up in there. That's an easy trip and fall. And now you look at the new station, it's so much more shinier there. The backdrop is just all chrome and it really looks good as far as presentation. You see one of the homemade posters from our Team Drip folks, and then you see some of our lovely CalFresh posters that you see there, which we changed 3 times a year, by the way. At one of our other different stations. But just look at the after picture where you see a new station and you see the old station, the discontinued one. I mean, such a pretty cool picture of night and day, right? Where you're able to really see, on how it started and where we are now, right? And where we all should be working towards. Because I think just looking at something nice and shiny is going to get you to want to gravitate to it versus something old and discontinued, right? All right, so here we are. So students' receptivity to the new hydration stations, okay? So we have to come back with another survey, of course, and we'll get to that in a minute. But we learned in the post survey that about 75% of the students now drink water from the stations, right? That's up 55%, right? And we're talking about having all these different stations in the school. The more, the merrier, the more, the better. The more stations you've got, the more likely kids are to drink the water. Keep it in mind that campus grounds are not necessarily small and compact. They stretch, bungalows here, different buildings there, and we made sure that they were all equally spread it out with relative spacing amongst the campus, so that doesn't matter where you are on site or on campus, you'll be able to have drinking water. And I'll let you know right now, the 8 water stations, I haven't even been over the entire campus. I do know where all 8 are, but some kids haven't even been over the entire campus to the point to where maybe half the group of kids see 5 stations while the other half sees the other 3 stations based off of classes, grades, and just where you're located for the most part. So our students were pretty receptive to those water stations because we had a lot of them. Post-survey results, we had 43 for the pre-survey, again, just working with one class the way we were thinking. And then we expanded that to where that particular instructor in the class had every class that they had for the day take the survey, which was about a third of the school with that particular number, 222 students, okay? And you'll see here, right here. He's got a bunch of yeses on there, but that's the majority of the pie there. And we saw a major change with the number of people who drink from these fountains. And they're now informed and more aware of the importance of water and how important it is. Thanks to 8 water stations, thanks to Team Drip and helping and assisting with the Rethink Your Drink demos, thanks to the posters all over the place, thanks to the morning announcements and the young people being able to hear folks that they can truly resonate with, other young people talk about the impact of water and how important it is to drink from it, and just sharing the new news that they may have not known about had they not heard it from our students themselves. So here you are. This is where our final presentation went down in the library. You can see 3 of our lovely young ladies in Team Drip sharing the goals and the pre-survey information and all the things that we had. And we actually had all of our main characters, operations, facility, custodians, and nutrition service administrators were all present at this particular presentation. And it was a beautiful thing because you can see the joy on these particular important people's faces, the administrators we're referring to who helped us out, our vested partners, because they could see that the work that they were doing were coming into fruition. They see the impact that they had just by ordering those stations to get to the school and be installed or be repaired or be cleaned or whatever the situation was. So it was really a great sight to see those young Team Drip members share that information to all those stakeholders and the responses from the stakeholders. And it's just the excitement that they had, just being proud of the fact that they were able to truly make an impact with young people and make sure that there was clean, healthy, accessible drinking water for everyone on campus. And I'm gonna tell you something, not only are students drinking from these water stations, I see so many instructors refilling their bottles everywhere. And they're like, oh my God, they're so thankful of the fact that they don't have to walk across the street to 7-Eleven to get water, which in turn, they might buy that iced tea, sugary beverage, right? Which we don't want. So now they can just stay on site and just drink great water from 8 different stations on our campus. So we had a testimony from one of our students. She was actually one of the last team members to join. And, we recruited her because we actually saw her frequently eating candy, sugary stuff, drinking sugary beverages, and we're never going to pass by these young people or adults or anyone at that matter when we're on site teaching and preaching about water access. We're going to stop any and everybody. We're going to talk about empty calories. We're going to talk about how much sugar is in it. We're going to show you physically how much sugar is in that beverage you're drinking, always having that information within reach. But when you read the quote, you can see it, and I'll go ahead and read it for you all. Before joining, I drank mostly soda and sugary beverages, which is true. But after working with Team Drip, I've been drinking more water than soda. And I feel like it's been a choice that I feel more healthy. And I've also noticed that some of my friends have been drinking more water as well since the demonstrations, the Rethink Your Drink demonstrations, that is, okay? So, between someone who was on the other side of the fence, seeing what we were doing, wanting to join the team, wanting to be a part of the efforts, be a part of the process. The more you're out there, the more, it's like it's contagious, right? Everybody catch on to it, right? And that's the idea. You want to make this as contagious as possible, create a certain level of energy where people are excited to show you a water bottle and say, look what I got, and all those beautiful things. So, and this really felt good hearing that from that young lady. So, what did we learn about our experience? We learned a ton of things that we've been sharing with you today about it. But of course, we learned to make sure that with your champ teacher, you want to make sure you align the right type of individual to help you with this particular initiative. They're going to be a key person for you, okay? So they have to be able to have time to be engaged and help you out. And we got it right this year with our PE teacher because she's a no-nonsense individual. She wants to get back to her health roots, which is going to help us with the sustainability portion. And we have a larger class, but there's tons of personalities and different minds that think differently and some that do think alike. So we learned to go with a bigger group. We learned to go with a teacher who can really, truly assist us. Unfortunately, the first year, we had some smaller assignments we weren't able to always get done with the kids. And we had those assignments only because the time we were working with, right? We weren't working with a lot of time, right? We were working with 30 minutes on some days, other days less, right? And you think about all the things that are attached to the scope of work and the resources from this behavioral economics of water access and appeal. You're going to need time, totally. You might say 45 minutes, 60 minutes, maybe more. We were literally doing this with about 25 minutes of time, speeding through this, making sure we were intentional. Create a lesson plan. We've got to scratch things out because it's going to take too much time. We condense everything. We give them as much information as possible. So we've learned a tremendous amount about the 2 different years that we approached this particular initiative. And of course, there's so much more that we can share with you, obviously. But you can always ask those questions later on in the Q&A section. When it comes to long-term sustainability, it can be tricky for long-term sustainability, but I tell you what, 8 water stations, that can go long, right? That can go a long way instead of 1 water station breaking down. I'll be doggone if all 8 water stations break down simultaneously, right? So we've got 8 water stations through our campus for them to drink from, right? I mean, there's a lot of other factors too that are involved as far as how, the water stations are kept, right? Who's going to be cleaning them? Are the students going to create a health group? A team drip? Is team drip going to be embedded within the school culture? So now they're walking around making sure that the stations are clean, making sure that there's refreshing posters and things of that nature. These are things that the young people can do, right? And then there's other things that may be out of reach when it comes down to the source of water, when it comes down to the water services and how they're maintained, and even the ability to influence programs, policies, and behaviors, right? So I think it depends on how shallow or deep you get into this particular project, what sustainability really truly looks like for you, right? And we're working on, we have lesson plans that we work on, that we go in week and week out, that we got from yparhub.berkeley.edu. And we mesh a lot of different resources together, but we're leaving these resources with the school in the hopes that the PE teacher who wants to get back in her health roots decides to make this a part of the entire PE program. Again, she is the dean of the PE program within the school when there's 3 teachers. So it's possible. So these are things that we're still working on as we speak, right? Because we're still in the initiative and we're working on the second year of it in year 3. All right, folks. So that's my time. I want to thank you all for being present today. And we really truly hope that this presentation was something that could help you, right? And if there's any other questions that you have, feel free to please go ahead and type those in the QA feature, and then we'll definitely get back to you, and Kelly will share those things out to us, okay? Have a great day, folks.
Thanks, John. Thanks so much. We actually have a few questions for you. So I'll go ahead and just read off a couple of those. And as John mentioned, please feel free to use the Q&A feature if you'd like to ask him a question right now. So the first question we got was other alternatives instead of infused water. We saw that great picture that you did of the infused water taste test, which I think is a great idea. I love that you didn't waste the fruit afterwards. And I wonder if you can share any other non-infused water ideas that you've done with the kids or that have been popular.
Oh yeah, definitely. I mean, believe it or not, infused water is truly popular because of the fact that you got fruit and vegetables and some roots possibly to eat afterwards. But some of the other things that we've done is we've used sparkling water as well and infused it as well to get young people to get a taste of what that is, and understand that sparkling water is a great step on progressions when it comes to getting folks to drink the infused water or just water altogether, right? Because it does have a little bit of extra flavor, a little bit of extra to it that they might like, that's similar to pop, soda, and all those things, right? We've also done smoothies, break the blender out and make some smoothies, fruit smoothies, and they love those as well. Obviously, the fraction that they get is not much, but they still do appreciate all those particular things. So these are alternatives instead of the infused waters. But I will say, when you use infused water, go with fruit so that you can utilize it after the fact.
That's great. Thank you. I love that you invited all of the characters back afterwards. All the folks that made this possible, from facilities to nutrition services to the administrators who really helped out with this. I think that's such a great point. In sort of showing the progress and the final product in a way for folks that have invested in this. I think that's such a key point. And getting at that, one of the questions that we got was there are many important issues that compete for school community resources and time, particularly among some of those administrators that you mentioned. So I wonder, how can we reinvigorate the conversation around SSB reduction in a way that's mindful of this and mindful of the fact that schools have a lot of resources that are, a lot of issues that are competing for their time and resources?
Okay, that's a good question. You're gonna have to make it interesting. You're gonna have to make it fun, right? Again, folks, like, I mean, the key word to me that I heard was competing for funds and time and resources, right? When you're competing, you got to show what you got. You got to get out there. Don't just check boxes. You know what I'm saying? Don't just do what you're supposed to do based on scope of work. That'll never work. I'm here to tell you. You got to go above and beyond. You got to put yourself out there. Again, some of the things that I shared with just, the Rethink Your Drink demos, being out there doing lunch where people are, pulling people to the side, showing them how much sugar is in their beverage. They're walking around with an energy drink, a sports drink, a juice, whatever the situation may be. But look at it from another angle as well. When it comes to wanting to invigorate this conversation about SSB reduction, right? And I use this little example and analogy here, right? Why do you like Disneyland, right? Folks like Disneyland for a particular reason. If Disneyland ever promoted the park, would you go? Or would you know? You probably wouldn't, right? Most of the time, things that aren't seen, being heard is one thing, but things that are seen, their eyes get excited and all those beautiful things. So you want to make sure you campaign it and you go out there and you show the people who are important in your school site, who have the funding, who decides, where the funding goes. You share with them how important this is. You share with them, the impact that it can make in the community with the kids, with the culture of the school, right? So I think that's important because, some folks just might write up a plan, a little action plan, send it in, and then that's it. You just read it, you might hear it, you listen to it, but you can't visualize what it's going to look like. We went out there and created a vision for folks to see before we really even touched the ground and got going for the most part, and created a certain level of excitement behind it. Like, this is truly important. And this is something that is an important topic that needs to be handled, obviously, before, the childhood obesity or SSB data increases, and it goes back to kind of where it started, probably about 20 years ago for the most part. So I definitely tell you, when you're competing, you got to make sure you go out there and show folks the importance of making sure that this program comes into fruition for the most part. And be fun and interesting. No one wants boring.
Yes, absolutely. I love it. Well, thank you so much, John, for your presentation and for answering our questions. GUSD is just such a fantastic example of what you mentioned, just going above and beyond, and your enthusiasm and just the care that you have for the kids is so obvious and evident every time I hear you speak. So thank you so much for that today. Please feel free, folks, if you do have additional questions after the webinar, please feel free to continue to submit those. And I just want to be mindful of our time and go ahead and wrap us up for today. I just wanted to close out today with a couple of reminders and resources that we have available for you. So as you continue your SSB reduction work, these will be provided via email to those who registered for the event. And we did get an additional question right after John wrapped up about if you want to market Rethink Your Drink or get some marketing materials, is there a place we can order posters and display them in the lunch area at schools? And the answer is yes. There's an entire Rethink Your Drink website. And when we provide follow-up resources after this webinar, we'll be sure to share that with you. The State Department of Public Health provides some fantastic posters. You saw that John had one up. GUSD has one up by one of their hydration stations. So we will be sharing that with all of you in our follow-up materials after the event. So thank you for that question. So as I mentioned, the follow-up resources will be provided via email to those who registered for the event. So even folks who weren't able to attend today, they'll receive them as well. We have a 2-page summary of our Sugar-Sweetened Beverage report that Deepa shared the data from that will be available in addition to a link to the report itself. And we'll have a resources page for some practical next steps in formulating your work. I also want to provide a reminder and a plug for copies of Sugar Proof, which is a book by Dr. Michael Gorin and Dr. Emily Ventura. Those are available for free for any of our participants in today's webinar, and we'd like to thank Dr. Gorin for generously offering that as a resource. So you can go ahead and add your shipping address to your Eventbrite registration if you would like to order that. We'll go ahead and keep that open until the end of the day on February 1st. So please feel free to register for copies of Sugar Proof if you're interested. And then we also have an exciting announcement that No Kid Hungry has committed to supporting the implementation of one of the recommendations from the SSB report. As a part of that effort, they'll be offering two $4,500 grants to school districts to go towards hydration stations. So we'll be sending more information about how to apply for those grants when we send the recording and resources from this webinar. And we expect those grants to be available around April or May. And then, as I mentioned, the recording will be sent out once it's been posted on our YouTube channel, Choose Health LA. So to keep an eye out for that in your email within the next week. Thank you so much for attending today. We would request, there's going to be a pop-up after the event asking you to take a survey for the event, and we'd please request that you do that and provide us with some feedback on your experience today. So thank you to everyone for attending, and we'll see you soon.